Hello and welcome. Today we're diving deep into a fascinating and somewhat rare condition known as Mirizzi syndrome. This complex digestive disease affects the biliary system, specifically the gallbladder and bile ducts. Join us as we unravel its mysteries, from its origins to its treatment, and everything in between. So, what exactly causes Mirizzi syndrome? At its core, it's all about gallstones. A large gallstone, or several stones, become impacted in either the cystic duct, the small tube connecting the gallbladder to the common bile duct, or in the neck of the gallbladder itself. This impaction is the primary trigger, leading to a cascade of events that define the syndrome. Let's talk pathophysiology, the mechanics of how Mirizzi syndrome actually develops. The impacted gallstone causes chronic inflammation. This inflammation then puts pressure on the adjacent common hepatic duct, the main duct carrying bile from the liver. Over time, this pressure can lead to erosion. The stone can erode directly into the common hepatic duct, creating a cholecystobiliary fistula, an abnormal connection between the gallbladder and the bile duct. This obstruction of the common hepatic duct, along with the inflammation, is what leads to the signs and symptoms we'll discuss later. Mirizzi syndrome is not very common. Estimates suggest it occurs in roughly 0% to 2% of all patients undergoing cholecystectomy, which is gallbladder removal surgery. It's slightly more prevalent in older adults, likely due to the increased incidence of gallstones with age. While no specific gender predisposition is definitively established, some studies suggest a slightly higher occurrence in females, consistent with the overall higher prevalence of gallstones in women. Now, what are the telltale signs and symptoms? Mirizzi syndrome often presents with symptoms similar to those of other biliary disorders, making diagnosis challenging. The most common symptoms include right upper quadrant abdominal pain, which can be persistent or intermittent. Jaundice, a yellowing of the skin and eyes, is another frequent symptom, caused by the buildup of bilirubin due to the obstructed bile flow. Patients may also experience fever, nausea, vomiting, and even signs of cholangitis, an infection of the bile ducts, in more severe cases. Diagnosing Mirizzi syndrome can be tricky, as its symptoms often mimic other conditions. A thorough medical history and physical examination are crucial. Imaging studies play a vital role. Ultrasound is often the first-line investigation, but it may not always be conclusive. More advanced imaging techniques like MRCP of magnetic resonance cholangiopancreatography and ERCP endoscopic retrograde cholangiopancreatography are often required. MRCP provides detailed images of the biliary system, while ERCP allows for both visualization and intervention, such as removing stones or placing stents. CT scans can also be helpful in ruling out other conditions. Mirizzi syndrome has been classified into different types, primarily based on the Bismuth-Corlett classification. This classification helps guide treatment strategies. Type I involves external compression of the common hepatic duct by a stone impacted in the cystic duct or gallbladder neck. Type I involves a cholecystobiliary fistula with less than 1/3 of the circumference of the common hepatic duct involved. Type EP involves fistula formation with damage to 1/3 to 2/3 of the common hepatic duct. And type IV represents complete destruction of the common hepatic duct due to the fistula. Treatment for Mirizzi syndrome depends heavily on the classification and severity of the condition. The primary goal is to relieve the biliary obstruction and manage any complications. For type I, cholecystectomy, or gallbladder removal, is often sufficient. However, more advanced types require more complex surgical procedures. These may include partial cholecystectomy, common bile duct repair, or even a Raux-NY hepaticojejunostomy, a procedure that reroutes bile flow from the liver directly to the small intestine. Endoscopic interventions, such as ERCP with stone removal and stent placement, can also play a crucial role, especially in managing cholangitis or as a bridge to surgery. Unfortunately, there's no foolproof way to completely prevent Mirizzi syndrome, as it's a consequence of gallstone disease. However, managing risk factors for gallstone formation can indirectly reduce the likelihood of developing this syndrome. These risk factors include obesity, rapid weight loss, certain medications, and a family history of gallstones. Maintaining a healthy weight, eating a balanced diet, and consulting with your doctor about any concerning symptoms are all important steps. The prognosis for Mirizzi syndrome largely depends on the timely diagnosis and appropriate management. Early diagnosis and intervention generally lead to better outcomes. However, delayed diagnosis or inadequate treatment can result in serious complications, such as cholangitis, liver abscesses, or even biliary cirrhosis. Recent research has focused on improving diagnostic accuracy through advanced imaging techniques and refining surgical approaches to minimize complications and improve long-term outcomes. Ongoing studies are also exploring the potential role of minimally invasive techniques, like laparoscopic surgery, in managing more complex cases of Mirizzi syndrome. As our understanding of this condition evolves, so too will our ability to effectively treat it.